Hi, it's Dr. Matt Russell from Vizon. In this video, I'm going to talk about how long it's going to take to recover from refractive lens replacement. So you're thinking about permanently correcting your vision problems through lens replacement surgery. And if you've lost your range of vision because of age, then lens replacement surgery is likely the best option for you. The really great thing about lens replacement surgery is that it not only corrects your prescription, one that you may have had when you were younger, but also it corrects the range of vision that you've lost naturally due to age, a process called presbyopia. So one of the main issues that concern people about going through lens replacement surgery is that because it's surgery, they feel that the recovery will be slow and uncomfortable. So it will probably surprise you to know that that's just simply not true. You'll likely be back to most of your normal daily activities, including driving and working within 48 hours. If you have a very physically demanding job, you may need to take a week off work before you can return. It's important to really discuss the nature of your work with me before surgery, and we'll give you an accurate indication of how much time you'll need to recover. But for the majority of people, they're able to get back to work within 2 to 3 days. That means if you have surgery on a Friday, which is a common choice for people, you'll be able to get back to work by the Monday, and you'll likely be driving the car by Sunday. As far as physical activities go, walking for exercise and workouts using stationary gym equipment can start 3 days after surgery. Light gym workouts, light Pilates, and yoga, as well as running and golf, can start 5 days after surgery. And you can get back to heavy gym workouts, swimming, and more intense Pilates or yoga, in most cases, even contact sports, after 2 weeks. Surgery itself is a day procedure performed under intravenous sedation, so you're going to be quite out of it. You're not going to be aware of the procedure taking place. Local anesthetic is used so that your eye is completely comfortable, very, very numb during the procedure, and the procedure itself takes about 20 minutes per eye. When you wake up, the eyes may feel a little bit gritty, but there should be no pain. That's very rare to feel anything that's uncomfortable. You'll be able to see, but the vision will be blurry for 12 to 24 hours. During the surgery, the natural lens of the eye is dissolved with ultrasound and replaced with an artificial lens or an intraocular implant. The distance vision is usually very clear within 2 to 3 days, and depending on the type of implants used, the near vision is also very good within 2 to 3 days as well. About 70 to 80% of patients achieve excellent vision very early after lens replacement surgery, and the vision quality continues to improve as the eye heals after surgery and as you adjust to the new optics of your eyes. Up to 30% of people have good vision initially, but they have a small residual prescription, which might, for example, make the distance vision slightly blurry. So you're able to legally drive without glasses, but you find that you can't see the street signs as clearly as you'd like. Or your distance vision may be good, but you may need to wear readers for small print temporarily, more so than you anticipated after the surgery. For this group of people, they have a very small residual prescription after the lens replacement surgery. It's really important to know that lens replacement surgery alone cannot guarantee zero prescription, and about a third of people will have a small prescription that will affect the quality of their vision and will need to be treated subsequently. It's important to understand that a small prescription can be treated with a laser vision correction procedure, usually LASIK, but that's done 3 months after the original lens replacement surgery was performed. There's no additional cost for having LASIK or any other laser vision correction procedure to correct or treat a small prescription in order to achieve sharp distance vision for driving or really great mid-range computer vision or reading vision. Depending on the type of implant that's been used, you may notice aspects of your vision that are not normal and may take some time to settle and improve. These include halo around lights at night, some shimmering of the vision during the first week or two, and sometimes an arc-like shadow in the side vision that can be usually seen in dim light in the first month or so after the implant surgery has been performed. Halos around night are by far the most common issue in the first 2 to 3 months following the surgery, and this is the most common reason that people are not happy with the quality of their night vision. Dryness is also a very common issue after lens replacement surgery. Dryness occurs due to a number of different factors. The most common issue is a reaction to the preservatives that are in the post-operative eye drops. These preservatives roughen the surface of the eye and they degrade the quality of the tear film, which influences the quality of the vision. So it's usually the surface of the eye that's the last thing to recover after lens replacement surgery. This really isn't complete until all the eye drops have finished, and you should expect to take eye drops for approximately 6 to 7 weeks after the surgery. The effects of the preservatives can be counteracted with the use of preservative-free lubricating drops, and you're likely to need to use these during the first 2 to 3 months after surgery. It's a good idea to continue them once the other eye drops have stopped, and this really helps the surface of the eye to recover. It's also important to know that when we do surgery, we do disrupt the nerves that supply the cornea in a very small location. We don't do this as much as we would do when we do LASIK surgery, but nevertheless, this has an effect in inducing some dryness, and corneal nerves usually take somewhere between 3 to 6 months to fully recover. Most people have mild dry eye after refractive lens replacement, but there's a small portion of people that react more significantly than others who have a much longer course of dry eye. It affects the vision quality much more, and it can take sometimes 3 to 6 months for these people to really feel that their eyes have returned back to normal. If after surgery you're experiencing dry eye symptoms, use the preservative-free eye drops. If those drops are not working, there are many ways that we can help people through that period where they're experiencing dry eye symptoms so that their symptoms are mild and tolerable. So it's important to get back in touch with us if you're between visits and let us know that you're having some issues. Just to summarize, generally speaking, most people who go through refractive lens replacement surgery will be enjoying their new vision within a few days of the procedure, and they'll be back to their regular day-to-day life. Most people returning to their work very quickly within 2 or 3 days, and most people back to light exercise within the first week, and back to their full range of physical activities after 2 weeks. So if you're looking to free yourself from glasses and contact lenses, and you're over the age of 45 and you've noticed your near vision has deteriorated, then it's very likely that refractive lens replacement is the ideal procedure for you. It's important that you go through a thorough evaluation, come and see us for a free assessment, and we'll see if you're a suitable candidate for the procedure and give you all the information that you need to know to make the decision to go ahead. So if you're over the age of 45 and you've noticed your vision is deteriorating and you're becoming more reliant on glasses, particularly for reading and computer work, and you're wondering what you can do to free yourself from those glasses, it's likely you're a good candidate for lens replacement. So go online and book a free assessment today and see if that's a good option for you and to see if you're a good candidate for the procedure.